Chao, chao, chao. Check, 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 check.
Good afternoon, everyone. Welcome to the Public Health Committee meeting. I'd like to convene. I think it's 1:02. Today, we've got some echo. If anyone has their computer audio on, if they can turn that off. Are we good? Okay. So I'd like to begin by offering our wonderful co-chair, Senator Anwar, the opportunity to say hello, and then our ranking members, and then we'll get started. Senator Anwar.
Thank you so much, Madam Co-Chair. Welcome. Thank you for all of the Public Health Committee members for being here, but also our team members with our leaders and LCO, OLR, each and everyone who's been working behind the scenes. So thank you for all the work and our ranking members for the very long meetings that we have already started. Thank you.
Thank you, Senator Anwar. Senator Summers.
Just good afternoon, everyone. I'm excited to raise some concepts, and I want to remind everybody that we are going to have a public hearing this coming Monday, and looking forward to getting started. Thank you.
Wonderful. Thank you for that reminder. I'll do that again at the end. It's good to repeat that so we can all know that we're gathering. Representative Claridis Tetria.
Thank you, Madam Chair. Welcome, everybody. Looking forward to a quick, speedy meeting. Thank you.
My father used to say brevity is the soul of wit. Thank you, Rep. Claridis Tetria. And I'll echo my thanks as we reach our raise bill deadline. This is our final meeting to raise bills. We, of course, will be continuing the conversation. We're going to move on to item number 3, concepts to be raised. And I am going to ask that we raise number 1, an act concerning educational materials regarding intimate partner violence towards patients. Number 2, an act concerning source plasma donation centers. And number 4, an act requiring newborn screening of Duchenne muscular dystrophy. Is there a motion?
So moved.
Moved by Senator Summers and seconded by Representative Berger-Gervallo. Is there discussion? Representative Denning.
I was wondering, is the chair open to any additional concepts to be taken this year? I know the nurse anesthetist did their public review and wanted to know if we could consider any of those in addition.
Thank you, Representative Denning. We do notice our meetings. I will just need just a second to consult with our attorneys in terms of process. If you can just give me a moment, we will Hang on just a sec.
Thank you.
Okay, thank you. So we are going to continue discussion on this agenda item, which is for these three concepts. Then if there were a motion to add an agenda item, we would have a vote on that. So is there further discussion on these agenda items before us? Seeing and hearing none, all those in favor, please signify by saying aye.
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 All opposed? Wonderful. We will hold the votes open until 3 p.m., I believe. Yes, we'll have votes open until 3 p.m. Before we move on, I will note that we will not be taking up, I know we skipped it, but item number 3, there was a bill raised in the Judiciary Committee. So I just wanted to note that for those in attendance. Representative Denning, do you still have your hand up?
Yes, please. I'd like to make a motion that we consider concepts for advanced practice for CRNAs and independent practice for CRNAs as well as APRNs.
Representative Denning, I believe the motion is to add an item to the agenda there's not anything properly before us. So the motion would need to be to add this item to the agenda. Would you like to
Thank
amend
you.
the motion?
I would like to amend to add the item to the agenda.
I second his motion.
So this, could you please again repeat your motion, Representative Denning?
I make a motion that we add to the agenda a consideration for independent practice for certified registered nurse anesthetist and for advanced practice nurses, removing the restrictions.
The motion before us to add an item to the agenda to consider independent practice for certified nurse registered CRNAs as well as APRNs. Is that correct?
Yes, thank you.
And there was a second from Representative Cook.
Yes.
So there is a motion and a second to add this item to the agenda. Is there discussion on the motion, Senator Anwar, to be followed by Senator Gordon?
Thank you, Madam Chair. Our LCOs have informed us there are multiple different issues that we are taking up. Last few of the ones that we have talked in our various discussions, we do not have the bandwidth to have more public hearings. We do not have the bandwidth to have our LCOs do more. So I would urge my colleagues to say no to this addition because frankly, we do not have this. We have discussed this. We have over 100 plus requests, and unfortunately, we cannot address more of all the requests that have been there. Thank you, Madam Chair.
Thank you, Mr. Co-Chair. Senator Gordon to be followed by Representative Cook.
Thank you, Madam Chair. And I do want to echo what my colleague, Senator Anwar, just said relative to taking this up, which really would be right now at the last minute to try to add this. In addition, if we are going to have a vote on the motion, I ask that it not be by voice vote. I think we should have a roll call on it. Thank you.
Thank you, Senator Gordon. The request has been made, and when the vote is taken, it will be taken by roll. Representative Cook.
Thank you, Madam Chairman. And I think that we really do deserve to have these folks heard in a public hearing. We could do it all in one day. And quite frankly, this is what we had promised that we would do for them last legislative session. We were supposed to have working groups for the APRNs. There was one meeting and they never met again. So I would really encourage us just to be having a hearing and see where we are, because at the end of the day, we know that we are very short with medical professionals. We have a huge crisis in care, and the APRNs and other folks could actually help fill those voids. So I think that to do our citizens the due justice that they deserve is to let them have a hearing. And this is literally about a public hearing. It's not yet about creating the policy, because we haven't had the hearing yet. Thank you, Madam Chair.
Thank you, Representative Cook. Representative Mara.
Thank you so much. I would like to echo Rep. Michelle's voice and say that we really have a mandate across the state to open up healthcare options for the Connecticut residents. We're seeing voids in options for healthcare, and I think we would do a disservice to our residents to not look at this as an option. Thank you.
Thank you. Is there further discussion on this item? I will add that as many of us here as legislators, we have school groups come who talk to us. Oftentimes when I have a group of students, I talk to them about what I describe as the funnel. We all put in bills and concepts, and through the course of the process, very difficult decisions are made in terms of how we budget our time and what issues we are able to hear before us, even to hear, as opposed to even to vote on. Of course, as we go through the JF process and we go to the House and to the Senate and the governor, we know that of those hundreds of bills and concepts that we start with, only a handful end up becoming law, and they are very difficult decisions. I will say that in this committee, it's been an honor and a pleasure to work with every discipline. Nurses, doctors, and every person who helps our patients remain well. I know we have more work to do when it comes especially to our APRNs and to others, multiple groups who have gone through scope review and have made requests. We as a committee work very collaboratively through our screening process, and these are the decisions we've made for the concepts to be raised. There is one piece of our APRN request that will be in our various revisions bill, so there will be an opportunity for testimony as part of that bill. But I would ask that this motion be denied and that we move forward with the agenda as set forth and publicly noticed. If there is no further comment,
Madam Chair,
Oh,
can I just-
Representative D'Amico.
may I just ask a question about, I don't want to call it a procedural question, but just an explanatory question. I believe Representative Cook just mentioned about some kind of commitment that was made last session with regards to this issue, and I don't have a good recollection of it, and perhaps you have a better recollection that would inform this discussion.
Thank you, Representative D'Amico. Last year in our bills, we actually passed quite a few working groups and task force legislatively, and some of those groups were never assigned and never met. The APRN working group conversation was an informal agreement. We had one meeting, and that's correct. No other meetings occurred, and I regret that that was the case. We need to continue those conversations. And Representative Mara and others, all of us here, recognize the incredible strain on our healthcare workforce right now. We are going to continue those conversations. So yes, we did have a stall. That doesn't mean that the conversations are over. It's at this point, the recognition of the leadership of this, the bipartisan leadership of this committee, that for the purposes of our hearings and bills, that we will be able to take up one aspect of the requests from our APRNs, but we'll need to continue the conversations outside the legislative process in order to be able to move forward. I hope that helps. If there is no further discussion, Madam Administrator, would you kindly call the roll?
Madam Chair, just as, if you don't mind, as a courtesy, could just a quick explanation as to what a yes vote means and what a no vote means for people who might have come in
Thank you.
late and so forth. Thank you.
Thank you very much. So the vote that we are taking is to add an item to the agenda. A yes vote means that we would add the item to the agenda. A no vote means no, we will not add the item to the agenda and we will move on to the next published item on the agenda. If the item is successful, we would then have to vote on the item itself. Okay, thank you for the clarification, Representative. And I see Representative Cook.
Madam Chair, could you just, as I'm looking at my screen, a whole bunch of people have just popped on. So they didn't hear the motion for amending and what was on that motion. So could we just, for clarification, let them know that? And I understand that we're in this crazy world of Zoom. Thank you.
Rep. D'Amico, as it turns out, I'm very glad you paused us so that we could clarify a few logistical details. First of all, the motion is to add to the agenda an act concerning independent practice of certified registered nurse anesthetists and advanced practice registered nurses. Clarifying that, we are holding votes open until 3. I've already announced that. So as a result, we would need to wait until 3 o'clock. If this agenda item were to pass, if we successfully add it, or if enough people vote yes to add this to the agenda, this committee would have to reconvene at 3 to then have a vote on the agenda item. So with that explanation, this is a
Point of
vote.
Information.
This is a vote to add this item to the agenda. A no vote does not, says we will not add it. A yes vote says we will add it. Representative Jenga to be followed by Representative D'Amico.
My question is, under what rules is this being enforced?
Rep Jenga, if you could just give me a moment.
Sure.
Ladies and gentlemen, thank you very much for this exercise in parliamentary procedure. I appreciate your patience. We are going to just recess for a few moments to make sure that we're doing things logistically properly and give ourselves as a committee a few options. So if you could just hold with us, and we're going to recess for probably about 5 minutes. Okay, we're going to reconvene the meeting. So everyone ready to come back? Representative Denning and Representative Cook. I see Representative Denning on Zoom. Is Representative Cook? There you are. Wonderful. I am going to ask that you withdraw your motion so that you can then make one singular motion in order to avoid the timing issue. And that motion, if you withdraw, it would be a motion that would simultaneously vote to add to the agenda for the purposes of raising the bill. Are you amenable to withdrawing the motion and doing that together after consulting with our LCO attorneys? Representative Denning, you're muted.
I'm sorry, I have the flu. You don't want to hear me coughing. Yes, I amend to that.
I'm fine with that.
So Representative Denning, you have withdrawn your motion, and Representative Cook, you have withdrawn the second.
Yes.
Okay. I will entertain a new motion. Representative Denning. The motion would be to add an act concerning independent practice of APRNs and CRNAs to the agenda for the purpose of raising that item.
I move that.
Wonderful. Is there a second?
I second.
Okay, thank you. Is there discussion on this item? Which again, to clarify, would then be basically 2 in 1. Is there further discussion on this item?
Yes, Madam Chair.
Thank you. Representative Summers, to be followed by Senator Gordon. I'm sorry, Senator Summers, to be followed by Senator
We're
Gordon.
all here. I just wanted to say a few things. You know, although I appreciate the focus on trying to have these bills heard, as someone who has sat through the screenings with my colleagues, there are literally hundreds of bills that we've had to go through to try to figure out what this committee can handle in the short 12 weeks that we have and what the priorities are. I'm not really aware of the commitment on the APRNs to raise this concept. I know that I think it's important we establish that working group. There were many, many working groups. I sat on many of them myself, and it's understandable that we ran out of time. So I will not be supporting adding this to the agenda at this time. I think that our committee is one of the largest committees as far as the volume of bills that we see. We have a lot of very detailed bills and compacts that we're going to be hearing. And I think this is something that we should wait until we have the working group. We can make a commitment to make sure that's staffed and looked at and maybe review these in the next session. Thank you. I just want to make sure that was on the record. So I want to support our chair here also at this late hour. If someone wants to add something to the agenda, it would be nice if they had let her know in advance, because we might have been able to come to an agreement before springing this on us in the middle of the committee meeting. So thank you.
Thank you, Senator Summers. Senator Gordon.
Thank you, Madam Chair. I want to echo what my good colleague, Senator Summers, says. I think this is an unfair process. We have a duly submitted meeting agenda, and I think it's unfair to committee members, but also unfair to the public, who maybe there might have been members of the public, if this had been known, might have wanted to listen in and find out what was going on this item. So I think it's unfair to the public as well for us at the last minute, unannounced, to raise an agenda item. If this were to pass, what's to stop anybody else, myself included, from going through pages and pages of things I could make motions on today? Keep us here for hours on items that perhaps we would want to have votes on. So I don't think it's a fair process. Not talking so much about the merits of it, but I don't think this is appropriate to bring up the way it's being brought up. Since there is a motion, I would ask that this be by roll call vote. Absolutely. But I also want to ask a question of the chair, and I don't want to put you on the spot. I'm not blaming you at all, Madam Chair. But what is the parliamentary standing of combining two actions in one? It's one, to have a motion to add something to a meeting agenda, If that passes, then you can take a vote on it. But if it doesn't pass, then you take no vote on whether or not to then act further. So I'm a little perplexed by what the standing is from the parliamentary process to combine two actions into one. It would seem to me the proper way is have a motion to add to the agenda and see if it passes or fails. And then you have a separate item if it then gets added to the agenda. So I'm just concerned we're trying to now rush something through and box the public out of knowing about it, and now trying to do two actions in one. So that's my question to you, Madam Chair, is the parliamentary standing to do two things at once in this motion.
Thank you, Senator Gordon. Because I had announced that we were keeping the votes open until 3 already and not immediately adjourning the meeting, the effort was made to allow folks to be able to vote without having to reconvene our meeting at 3 o'clock. I understand the comments by both our good ranking member and your Senator Gordon, your comments as well. We as duly elected members do have rights to bring things up at meetings, and the comments are fair in terms of the process. As I mentioned earlier in my remarks, we as committee leaders in every committee in this building do make decisions about what we can and cannot hear, what we reasonably believe that we as a committee, that members of the public, our nonpartisan attorneys are able to take on in any given session. They're very difficult decisions because here in public health, our decisions are often about life and death and about assuring that people's well-being is taken care of. So to answer your question, Senator Gordon, I hear what you're saying. We did consult with our nonpartisan LCO attorneys to see if this was a way that we could have this vote go forward. And if there's no objection, we will continue in that way, but I understand your concern. I don't think I have a great answer other than this is a compromise and an effort to try and give voice to what members of the committee are speaking to. Oh, I'm sorry. Representative Claridis Teacher, before you do go, I just want to recognize there is some feedback in the room. I don't know what that is. I'm not sure if we can get some technical assistance. We're just having all kinds of fun here today in public health. So just bear with us. Representative Claridis Teacher to be followed by Representative Denning and then Representative Cook.
Thank you, Madam Chair. I just want to remind people in person and in virtual land that this went through scope review with the Department of Public Health, and it came back that the committee failed to reach consensus. So something was done. So this is, though I want everybody to get a public hearing, we have to follow the process. And this did go through the process. And then to do this at the last minute isn't fair to every other discipline that wants to do the same thing. We would be here for 20 hours if everybody wanted to resubmit what they felt was important to be on the agenda. I just want people to recognize that. Thank you, Madam Chair.
Thank you, Representative Claridis Teacher. And I will clarify that we have two different groups on this amendment, the CRNAs and the APRNs. The CRNAs did recently go through the scope review, which I imagine Representative Denning may speak to. Representative Denning. Representative, you are muted.
Excuse me. Hi. I know I'm sorry to have put you in this situation, but I know that we should follow a process. But I did take an oath to follow and support the rule of Mason. And did I not follow the rule of Mason?
Representative, I apologize. We have some technical issues happening in the room, and I was having a side conversation with someone here. So this motion is before us. We are there. If you would like to comment and make comment on the motion that is properly before us, please do.
Thank you. I still support this bill. This doesn't exclude the public. by no means it gives them the voice to hear what's going on in our healthcare system, how we can make it better, faster, cheaper. And as this is my last year, I wanted to see whatever I could using the rules of Mason to make sure that I could get this at least for a public hearing. And I apologize for any trouble that I'm causing, but I learned from actually a senator when I watched him use this process yesterday, and it just seemed like this was a good time to try it.
Thank you, Representative Cook.
Thank you, Madam Chairman. And I hope that no one out there feels that this conversation has not been happening for years now, specific to the APRNs. And it just seems like we're getting pushed off and pushed off and pushed off because there are a few folks that don't support it. And so they're being railroaded. And that is really where the problem is here. So it's about giving them an opportunity to come back to the table and be heard. And at the same time, this is definitely about folks getting medical care. And we know that there is a shortage of medical care in our state in every arena, and that the APRNs really do fill that void, but we are not giving them the opportunity to fill that void. So if I could separate the two, I would, but I don't want to convolute this conversation any more than where we are right now. But I really do think that our constituents deserve to be heard, and our APRNs deserve to be heard. And they have not gone through the scope review. They've not been allowed to move past a request from this committee because of a few folks on the committee. So, Madam Chair, that is not at all directed to you or a disrespect to you. I have the utmost regard for you and your leadership. And I know that this has been a challenging time for you. So with all of this being said, my heart goes to you and your family, and I apologize for putting you in this predicament.
Thank you, Representative Cook. Senator Gordon.
Yes, thank you, Madam Chair. I've heard what my colleagues say, and I think we are doing a disservice to the public bringing this up at the last minute when they don't know it's being added to the agenda and don't have advance notice. And I look forward to having further discussions about, is there really validity to expanding scope of practice, providing more access to people? I don't think necessarily that's really what this is about. And I kind of know quite a bit about it being a doctor in the field for more than 30 years. But my question to you is, Madam Chair, I've heard people mention in this motion CRNA, and now I've been hearing APRNs. Can I seek clarification? What exactly is this motion, word for word, that is now before us, so that way we can be clear? What is it that we're being now asked at the very last minute to vote upon that has substance? And now it's unclear to me, given what the proponents of this motion are actually saying. Is it CRNA, APRN, or both? I just want to know what the exact wording of the motion is, if you don't mind, Madam Chair. Thank you.
Sure. Thank you, Senator Gordon. No one in the room has access to a written motion right now. I will repeat it verbally. This would be to add an act concerning independent practice of APRNs and CRNAs to the agenda for the purpose of raising that item, which is a concept. And I will remind you that concepts are what we raise, unless in item number 4, we will be voting to draft a proposed bill. But when we raise concepts, there is no language for the bill before the committee. The language is then drafted, then put before us for public hearing. Following public hearing, we subsequently have language before us for the joint favorable vote by the committee. So there is no language today other than that title, which includes both APRNs and CRNAs. Do you have further comment, Senator Gordon?
I do, and Madam Chair, I appreciate the clarification, and I'm seeking another clarification. So if this last minute and unexpected motion is now being independent practice for APRNs and CRNAs, what exactly are we looking to do to raise a concept for independent practice of APRNs? My understanding is by law, they do have provisions for independent practice. So now I'm confused. We've gone from CRNA last minute motion, and now we're adding APRNs. I don't want to say we because I still object to the process, but I'm trying to now understand why is independent practice for APRNs being added? We have current law. What more is it that is looking to be raised relative to APRNs in with CRNAs? It's becoming more and more confusing, which gets to my point why we shouldn't be having these last minute motions. Again, I don't blame you, Madam Chair. I just want to make certain myself and my colleagues and the public are well aware and understanding what is this motion that now we're being asked to vote upon. Thank you, Madam Chair.
Thank you, Senator Gordon. If one of the proponents would like to respond to the question, you may. I see Representative Denning, you have your hand up and you are muted.
Okay. Hi, Madam Chair. The primary problem with advanced practice nurses is that they have to go through a intern program with a physician for 3 years before they can actually start their independent practice. And there's a reticence of many doctors to take on the responsibility of having an advanced practice nurse. You can't hear me, can you? Can you? Okay. So the opportunity for them to follow under another APRN gives them the opportunity to get more APRNs out into the field and adequately trained with the experience they need. And so I would focus the motion, or I would focus any bill towards that language.
Thank you, Representative Denning. Senator Gordon, and to be followed by Senator Summers.
Thank you, Madam Chair. I disagree with my good colleague, Rep. Denning, having been a doctor for more than 30 years and knowing my medical colleagues in Connecticut, there is no reticence. And I've trained and worked with APRNs for many, many years. If indeed we're now looking to see about CRNAs and expanding further APRN scope, this is becoming a big, big issue that could really create a lot more additional work at the last minute without forethought for this committee. We need to be very careful what we're trying to do and think about it. And one thing we have to also, and I'll caution my colleagues, is I have no problem with people who want to be APRNs, CRNAs, physician assistants, whatever. But to have more and more expansion of scope of practice to do what doctors do, then quite frankly, go to doctor school, do all the years of training and all the extra years of training. This is really, we need to be careful what we're thinking about here to bring this up at very last minute. It's a very complex issue. There have been scope reviews, and I think we need to respect that process. And I would suggest, again, to vote no on this. We will have more time next year in a longer session with more advanced warning to be able to think this through. Otherwise, be prepared that you can have very long meetings and public hearings to try to resolve something that may really not be able to be resolved right away. It's not a simple snap of the finger. So I just want to caution my colleagues about at the last minute trying to add this big, big issue on, because there'll be other aspects to this that will then be others will look to add on. I just want to caution all of us about what people are proposing to do. Thank you, Madam Chair.
Thank you, Senator Gordon. Senator Summers.
Yes, and thank you. And I don't want to belabor this for too long, but again, we went through hundreds of bills in screening, and this is what the committee, bipartisan and actually with the vice chairs had decided was the bandwidth of this committee. I want to also make sure everyone is aware that APRNs in our revisions will be discussed as far as allowing them to do a new procedure. So if the APRNs would like to come and testify concerning independent practice, they would have the ability to do that when we have our hearing on our revisions bill, and we certainly could entertain it at that point. So I just wanted to make sure everyone was aware of that. There would be another avenue for them to discuss this. And I hope we can wrap this up. I don't want to get into one practice versus the other at this point. This is really about adding something to the agenda that was not passed through our screening committee that we spent hours with for various reasons. So thank you.
Thank you, Senator Summers. After a robust discussion and seeing no further discussion, Madam Administrator. would you kindly call the roll? And I will remind folks that a no vote means we will not add this item to the agenda and it will not be taken up. A yes vote means that it will be added to the agenda for the purposes of raising the bill. Madam Administrator.
Senator Anwar,
Senator Anwar votes no.
Representative McCarthy Vehy,
Representative McCarthy Vehy votes no.
Was just to clarify that this was not savings, and that it was really new.
Senator Kushner, Senator Marks, Representative Parker,
Hey, Senator Marks is here, Bev. I apologize.
Senator Marks,
Senator Marks votes yes.
Representative Parker, Senator Summers,
Summers votes no.
Representative Clarice Detrier,
Clarice Detrier is no.
Representative Belton,
Belton votes no.
Representative Burgess Givallo,
Burger Givallo votes no.
Senator Cabrera, Representative Carpino,
Representative Carpino votes no.
Representative Cook,
Cook votes yes.
Representative Dauphiné, Representative DiCaprio, Representative D'Amico,
D'Amico votes no.
Representative Denning,
Representative Denning votes yes.
Representative Elliott, Representative Django,
Representative Jenga votes no.
I didn't hear you, Representative Django.
Representative Jenga votes no.
Thank you. Representative Gilchrist,
Representative Gilchrist votes no.
Senator Gordon,
Senator Gordon votes no.
Representative Cavros DeGraw,
Cavros DeGraw votes no.
Representative Kitt,
Representative Kitt votes no.
Representative Kennedy,
Kennedy votes no.
Representative Lenahan, Representative Morrow,
Representative Mara votes yes.
Representative McCarthy,
Representative McCarty votes no.
Representative Palm,
Palm votes no.
Representative Perello, Representative Rader,
Representative Rader votes no.
Senator Rahman,
Senator Rahman vote no.
Representative Reddington Hughes,
Reddington Hughes votes no.
Representative Ryan,
Representative Ryan votes no.
Representative Ryan,
I'm still voting no.
Senator Slapp,
Senator Slapp votes no.
Representative Steinberg,
Representative Steinberg votes no.
Representative Tersiak, Representative Waylando,
Representative Welander votes no.
Representative Zupkis,
Zupkis votes no, but hopes the task force will do their job.
Hi, Bev, can I vote?
Madam Administrator,
Representative,
we did, I believe, yes, we have Representative Parker, and if there's anyone else on the Zoom.
Thank you, Madam Chair.
Representative-
Representative Parker votes no.
thank you.
Madam Administrator, I know that we will be holding the votes open until 3. I will note that based on what that tally was, I don't believe that the item, even after 3 o'clock, will have the votes to pass. Before we move on to the next item on our agenda, I will thank you all. Democracy is a difficult, deliberative process, and sometimes can be a little messy for us, but I very much appreciate the passion and advocacy with which every member of this community approaches their work. And with that, we will move on to item number 4 on the agenda, proposed bill to be drafted as a committee bill. Item 1, proposed Senate Bill number 175, an act concerning funds for the Rare Disease Advisory Council. May I have a motion?
So moved.
Moved by Senator Summers and seconded by Representative Berger Javallo. Is there discussion on the item? Seeing no discussion, we'll take a voice vote. All those in favor, please signify by saying aye.
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 Any opposed? Wonderful. Thank you. Moving on to item number 5 on our agenda. And-
Madam Chair, point of order, only to ask a question. Have we taken a vote on the concepts to be raised?
We
I
did
don't
it.
recall with all this.
Thank
whirlwind of
you.
activity.
We did have a voice vote,
Great.
Representative,
Great,
yes.
thank you. I feel better.
And again, the meeting, the meeting will be held open until 3 p.m. for those who missed the opportunity to vote and to be counted for attending. Item 5 on the agenda is announcements. As Senator Summers mentioned at the outset of the meeting, which I thought might be quicker, but hey, we're here. Public hearing, we will convene on Monday at 11. We will begin our public hearing process. We very much look forward to and welcome the public joining us for their 3 minutes, which we will keep everyone to. We will have another public hearing that's scheduled for Friday, March 1st at 1. And we will have a committee meeting, which will be Monday, March 4th at 11 a.m. With that, I want to wish everyone a wonderful weekend and thank you all for spending the time here together today.
Hey, Bev, it's Senator Marks. Are you there?
Yes, I am.
Were there any other votes that I missed?
No, it was all voice votes.
Okay, much appreciated, Bev. Have a great weekend.
Representative Carpino, it was only one roll call vote and you voted.
I just wanted to be sure. Have a great weekend, Bev.
Same to you.
Good, good afternoon, Senator DiCaprio.
How are you?
Um, can you hear me?
I can hear you.
I'm good. How are you?
Good.
We had one. Okay, that's good. We had a voice. Oh, sorry. We had a voice vote from items number 1, 2, and 4,
Okay.
and we had a motion to add to the agenda. And
He should vote on the first one, first section 1 with the 3 bills. And let him know it's a
Okay.
voice vote and
That's
figure out what he wants to do.
okay. I let him know it's a voice vote. So how would I add the
And just ask him if he concur, if he wants to concur with it. If not, we have to start the meeting all over again.
concur?
Same to you.
Sorry, there was a process. I'll need if you can give me 1 second. I need a clarification. I'm sorry. I'll be right back.
Go ahead.
That's why I
popped over here and there's a couple things you weren't here.
Are you saying I'm a slapper?
No, that's what I'm just saying.
Okay. I was told to tell you it was a voice vote and to vote yay or nay.
What room are you in?
I'm in room 3000, the Public Health Committee.
2000?
3000.
3000, yeah, well, okay. Well, I concur.
Okay. All right. I got your vote. I have your vote. You're good.
Okay, all right, thank you very much.
Yeah, no problem. Bye.
Okay, bye.
Hello, Representative Daphne.
Hi, good
Hi,
afternoon.
good afternoon. So we had a voice vote for items 1, 2, and 4.
Okay,
And then we had a motion to add to the agenda another item.
oh,
Uh-huh. And that was on a roll call vote.
and which one was that?
It was a motion to add to the agenda a new item.
Right, what was the item is what I meant.
Oh, okay. And at consider do you know the title, the title,
Here's
the
what
full
she had.
title? No. Oh, I'm getting that 1 second. I'm sorry. It was a
It's okay.
concept.
Was it a dummy bill?
It was a concept. It had to do with CRNAs and APRNs and their scope.
Okay. What was who did anybody vote against it?
Are you asking who voted against it?
Yeah,
We had everyone vote against it except Senator Marks, Representative Cook, Representative Denning, and Representative Mara.
they all voted for it.
Yeah, everyone else voted against. Yeah, those 4
Okay,
voted
I'll
on
be
it.
a no.
Okay, all right, I got your vote. And then the vote, item 1 for Roman numeral 4 to be drafted, that was just a voice vote. So you're all set.
Okay,
Okay, you're all set.
I'm all set. Thank you so much.
Yeah,
Have a
yeah,
great
yeah.
weekend.
You too, bye.
Yeah, bye-bye.
Good afternoon, Representative Perillo.
How are you?
I'm good. How are you?
Great.
Okay, so on the agenda, we had a voice vote for concepts to be raised for numbers 1, 2, and 4. We had a voice vote.
Yes.
And then
We
we
pulled
had,
item 3, is that correct?
yeah, because it's being raised in judiciary.
Okay.
And then Representative Denning motion to add to the agenda an act concerning APRNs and CRNAs. And
To add to the agenda.
yes, to add to the agenda. And that was on a roll call vote.
Question, when did he add it?
He made a motion to add it. And that was a
Oh.
roll call. We had a roll call now.
Let me rephrase. When did he make the motion to add it?
After the voice vote for 1, 2, and 4.
Okay. And it was what?
An act concerning APRNs and CRNAs.
Let me do some reading, and I'm just going to mute myself if you don't mind.
No, that's okay. I understand.
And I'll just ping you when I'm ready.
Okay.
Thanks. Peter, I'm back.
Okay, I'm available to take your vote.
Thanks. I appreciate that.
Yeah, no problem.
I am a no.
Okay. Yeah, I got you. And then for the proposed bill to be drafted as committee bill, that was a voice vote, so you're all set. Okay.
Thanks.
Yeah, no problem. All right, bye. Have a good day.
Appreciate it. Have a great weekend.
You too. Good afternoon, Representative Parker.
Hey, how are you?
I'm good. How are you?
Good, thanks.
Mm-hmm.
Looking sharp for the meeting today. That's
Thank you.
awesome. Thanks
Mhm.
for doing your job so great. Anyways, I voted on the roll call vote, so I don't know if you need anything else from me.
No, you're all. If that, no, you're all set. If you.
It was just that one,
Yeah.
roll call no, and then the others was a voice vote.
Yeah, it was a voice vote. Yeah.
Okay, perfect. Thanks.
All right. Yeah, bye.
Adios, brother. Have a good weekend. See ya.
You too. Yeah. Where's my agenda? Here's my agenda. Okay.
Hi, Peter.
Hi, Senator Kushner.
Did I say
So-
your name correctly? Because I know it's spelled a little different.
That is correct. Yeah.
That's pronounced Peter, right?
Yeah. Yes. So we had a voice vote for items 1, 2, and 4 for concepts to be raised. And after that, we had a motion by Representative Denning and a second by Representative Cook to add to the agenda an act concerning APRNs and CRNAs. And the motion was to add it to the agenda.
And how did that go?
Only 4 people voted yes.
Okay. I'd like to know.
Okay.
So you need my vote on that?
Yeah, it's a roll call vote.
I'll vote no on that.
Okay. And then for proposed bills to be drafted, that was just a voice vote, so you're all set.
Okay. Is it possible, well, I'll go back and watch the meeting so I'd hear all of it. I was in another meeting, obviously. We have conflicting meetings all the time, but I'm sorry I couldn't be there. So, but thank you for holding votes open.
Yeah, no problem. Okay. Have a good day. Bye. Hi. Good afternoon, Representative Linehan.
Good afternoon. Do you need to see my face to vote or is
Yeah. Is a
okay?
mask is a mask okay?
You recognize her. I know it's please. Go ahead and take
Okay. All right. So for concepts to be raised for items 1, 2, and 4, it was a voice vote.
Yes.
And then we had a motion by Representative Denning and a second by Representative Cook to add to the agenda an act concerning APRNs and CRNAs. And the motion was to add it to the agenda.
That motion I'm okay with.
So you'll be voting in the affirmative? You'll be voting yes on that motion?
Just to add it to the agenda, sure.
Okay. All right. And then for proposed bill to be drafted as committee bill, that was a voice vote, so you're all set.
Okay, so wait, now I'm confused though. Did you vote on that bill or so we added it to the agenda, but does that mean
We didn't add it to the agenda because it didn't have enough votes to. Oh, the vote is still open to add it to the agenda. So if it passes at 3 p.m., we will reconvene to vote on it.
okay, then hold on. Then I want to
No,
know.
no. But in case, and if it does pass.
All right, so I might change my vote.
Okay.
Can you tell me, because it wasn't part of the original package.
Yeah.
So I'm gonna abstain because I wasn't on the meeting. I wasn't able to
Okay.
hear it. So I'd like to abstain and stay out of it.
All right. Okay. I got you as abstain.
All right. Is that
And
it?
then, yeah, the last was a voice vote, so you're all set.
Thank you. I apologize. This is like ridiculous, man, but thank you so much.
Have a good day.
You too. Bye.
Bye. It's not muted.
Hello?
Good afternoon, Representative DiCaprio. So the roll call is about the title of the bill, or the concept is an act concerning independent practice of APRNs and CRNAs. And they wanted to add that concept to the agenda for the purpose of raising that item.
Okay.
Mhm.
I concur with that.
So you'll be voting yes in that?
Yes.
Okay, all right, I got your vote.
All right. Thank you.
Bye.
You're all set though, right?
Yeah, I'm all set now. Thank you. All right,
All right. Thanks.
all right, thanks, bye. Have a good day.
You too.
Representative Elliott.
Oop,
Hello.
There we go. Hey, how's it going?
Hi. Hi. Good afternoon, Representative Elliott. We had a voice vote for items 1, 2, and 4 for concepts to be raised.
Great.
And then we had a motion by Representative Denning and a second by Representative Cook to add an act concerning independent practice of APRNs and CRNAs to the agenda for the purpose of raising that item. And that was a roll call vote.
What happened with the vote? Where we at right now?
We have 1, 2, 3, 4, 5 in the affirmative, 1 abstain, and the rest voting no.
Both chairs voted no?
Yes, both chairs voted no.
I'll vote no.
Okay. I register your vote, and then for proposed bills to be drafted as committee bills, that was a voice vote, so you're all set.
All right, thank you.
Yeah, have a good day.
You too.
How about now? Am I coming through now?
Yes, I hear you now and I can see you clearly.
I vote
Representative
yes.
Curtis.
On the votes I missed. Want to run
okay.
through them real quickly?
Yes, let's vote. Let's go
It's
through them real
okay if
quickly.
you'd like to.
Okay. So for concepts to be raised for items 1, 2, and 4, we had a voice vote.
I'm yes on those.
And then Representative Denning motioned and Representative Cook seconded, adding an act concerning independent practice of APRNs and CRNAs to the agenda for the purpose of raising that item. And that's a roll
Sure.
call vote.
That's a
So
yes.
you'll be voting yes?
Yep.
And then we had proposed bill to be drafted as committee bill. That was a voice vote, so you're all set.
And I'm all set. I'm a yes there too. Thank you very, very much. Appreciate
No
you
problem.
sticking with me through all this trouble, Piotr. See you later.
It's okay. You too. Bye. Thank you.
Bye.